Hello, I am Rebecca Aberg, Inclusion Specialist at the International Foundation for Electoral Systems. And today I'm joined by Samchana Gamiri, who is from Nepal Disabled Women Association and will provide some insights into the work that NDWA is doing right now. Samchana, could you please say a little bit about yourself and your work with NDWA to advocate for equal access of the rights of Nepali women with disabilities?
Okay, thank you, Revika. I am Samjana Gimire, originally from Viratnagar, province number 1, eastern part of Nepal. Talking about my educational background, I have completed master's degree in child development and gender socialization, and my bachelor degree is in public health. In the same way, talking about my professional experience, I have been working in the development sector for the 10 years with different non-governmental organizations. I have closely worked with different level of government from federal to local level to seek support in project planning, implementation, monitoring, reporting, and advocacy-led initiatives. In the same way, my work with Nepal Disabled Women Association begins since 2011, starting as a general member. Since then, I have been engaging in different programs and forums of NDWA to advocate for the rights of women with disabilities. From August 2018, I have been working as a project coordinator in NDWA. I look after the project Power to Pursue, empowering women with disabilities to influence public policy, which is implemented in 5 districts of Nepal and 4 provinces, 1, 3, 4, and 7 of Nepal. In the same way, the project is technically and financially supported by International Foundation for Electoral System and USAID respectively. From this project, my team has been engaging with local stakeholders as elected representative, local government, CSOs and community people to make them aware about the issues of women with disabilities and ensuring the meaningful participation of women with disabilities. In the same way, the project is also developing leadership capacity of women with disabilities through training, interaction, dialogue program, etc. Because of these, many local units, local leaders have started to recognize the importance and need of women with disabilities. And women with disabilities have been hired as resource persons to create awareness on disability issues at local community level. And they are offering job to many women with disabilities and allocated budget and program for women with disabilities during the local planning process.
And Samchana, how has the COVID-19 pandemic impacted women with disabilities in Nepal?
Actually, persons with disabilities are the most marginalized groups under this emergency condition. All of we know that. Among them, women with disabilities are the most vulnerable groups. Women with disabilities are suffering many hurdles uh, for their livelihood and also suffering from extreme hunger in some cases. Considering this current countrywide lockdown in Nepal, NDWA did different consultation with different groups of persons with disability, among with women with disabilities. Through this consultation, it was found that persons with disabilities and their families who are extremely vulnerable conditions and are badly affected to their daily lives, we can say that someone with disabilities who were employed and on some of money had to forcefully left their job, and those who are started their business had turned out from their business and income generating activities. Similarly, women with disabilities having spinal cord injuries are facing big health challenges due to unavailability of daily medical kits and clinical apparatus like clean intermittent catheterization they specifically need for everyday basis. Furthermore, the health of girls and women with disabilities who have spinal cord injuries or on wheelchair is getting worse due to continuous bed rest at home because of lockdown, and this has resulted into body swelling, urinary tract infection, and infection in backbone also. Similarly, menstruation hygiene management is challenging for girls and women with disability in this COVID-19 pandemic. Many girls and women with disabilities are suffering from domestic violence also. No proper reporting and recording system is managed by government of Nepal for women and girls with disabilities. Similarly, during this lockdown, 2 women from Morang districts around 18 and 52 years had died. The reasons for their death was due to no access of transportation to take them to hospital, difficulty in getting medicine on time, and also less priority given by their family members on their health, so that they died. And the government is distributing relief materials without prioritizing the persons with disabilities. And different committees and groups have been formed at the local level to federal level for the response of COVID-19, but there is no participation of women with disabilities in those committees. And the quarantine facilities, isolation bed, and other managerial procedures are not accessible for persons with disabilities. And information and education regarding COVID-19 is also not disseminating in easy to read format. So women along with persons with disability are depriving from getting information also. So all those things.
Thank you for providing that context. It sounds like women with disabilities in Nepal are facing a number of challenges and intersectional barriers because of their disability and their gender. In this context, what actions has NDWA taken to address the impacts of the COVID-19 pandemic on women with disabilities?
Yeah, NDWA has taken some couple of actions to respond to the COVID-19. I want to mention some of them. First of all, NDWA is sharing the information through social media platform like Facebook, Twitter, email, Viber, and keeping a network with government and sharing the decision of government provided in regards to COVID-19 activities. In the same way, raising the voice against violence against women with disabilities during COVID-19 through different social media platforms like Facebook, Twitter, Viber, all those things. Similarly, the National Trading Center is delivering gas cylinders at the doorstep of persons with disabilities to those who have disability identity card. And NDWA is coordinating online with the National Trading Center and providing them with the details of persons with disabilities who need gas cylinders for cooking. And the National Trading Center is accordingly delivering the gas for the needy persons and women with disabilities. Furthermore, NDWA is supporting for the distribution of relief material to the women with disabilities in the different part of Nepal. And it is attending in-person meeting with mayors and deputy mayors along with ward chairs and different chiefs of tertiary level institutions like Ministry of Health and Population, Ministry of Women, Children and Senior Citizen, UN agencies and other like-minded organizations. Furthermore, NDWA is participating in different meeting through online like Zoom cloud meeting and through Skype with the government and non-government line agencies, and supporting to provide medical supplies for needy people like hemophilia, for the spinal cord injuries persons. And it has submitted memorandum to the Ministry of Women, Children and Senior Citizens also for the basic requirement at safe houses and rehabilitation center established for women with and girls with disabilities. And government nowadays government is started to collect information about the persons and women with disabilities also, for the relief material, for the other kind of support also. Similarly, it has conducted Zoom cloud meeting for the progress of Sustainable Development Goal review in the perspective of gender and disability on 21st May 2020. So it is regularly coordinating and contacting with women with disabilities and advocating for their problems also.
That's great to hear. It sounds like NDWA is doing a lot of really important work right now on the rights of women with disabilities during the pandemic.
Yeah.
So Samjana, you mentioned earlier that you are coordinating the Power to Persuade project, and I was wondering if you might be able to say a bit about how your participation in the Power to Persuade training with women with disabilities prepared you to advocate for services and resources for women with disabilities during COVID-19.
Yeah. Actually, Power to Persuade fosters my leadership skills and of other women with disabilities, and developed skills to engage with government and other stakeholders also. And Power to Persuade supported to increase the socio-political participation of women with disabilities in local, provincial, and federal level. And with these, I'm more motivated to work closely with local government to advocate for the services and resources for women with disabilities during COVID-19, and which is much in the context of this lockdown and COVID-19 pandemic. Basically, I'm coordinating and advocating with the stakeholders for the essential services and resources such as distribution of relief materials, focusing on women and girls with disabilities, and advocating for accessible services like quarantine, isolation bed, and easy to read information or awareness material for COVID-19. Similarly, raising the voices for meaningful participation of women with disabilities in the different committee of COVID response, and creating awareness about the preventive measures of COVID-19 and promoting the health lifestyles like maintaining hygiene and sanitation, maintain social distance, and alertness about gender-based violence, all those things.
Great, thank you. So Samjana, what lessons would you share with other advocates to ensure that women with disabilities have equal access to services and information related to COVID-19?
Yeah, actually, meaningful participation of women with disabilities is in every response committee is needed, so that every facility will be accessible for all kind of women with disabilities. So we have are physical, some are blind, some are deaf, some are intellectual. So there should be accessible services for women with disabilities. For this, there should be the meaningful participation of women with disabilities. And next is that information and educational materials should be disseminated in easy to read format, through the women with disabilities can take care of their health, right? In the same way, even single advocates should incorporate the need of women with disabilities and advocate for the distribution of required materials to all the needy people. And communication and coordination with the local level institutions for awareness, information collection, and dissemination is most important.
Thank you so much for sharing all of this information, Samjana, and for this interview today.
Okay, thank you so much for providing me chance to share my view and the current situation of Nepal about women with disabilities.